Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. I am pleased to welcome Dr. Nathan Ford, a clinician based in Los Angeles, California, focused on prevention and regeneration. Dr. Ford, thank you so much for being with us today.
My pleasure. Thank you so much for having me.
Great. Let's get started. Dr. Ford, how were you introduced to anti-aging medicine?
You know, I feel, when I tell the story, I feel like I'm fortunate because, most physicians and clinicians that I've met, over the years in this field, have a story of, going through their career as an internist or plastic surgeon or, some variation of specialty where they had to go through their career, kind of figure out the limitations, imposed by traditional practice, and then transitioned out and found this amazing field that we're in of anti-aging regenerative medicine and incorporated it. And, some people fully transitioned. Well, I've only been practicing about 9 years now. And, I was in the UCLA Charles Drew medical program. And it's an important distinction because we really make a commitment to focusing on treatment to the underserved, providing services to historically underserved populations. And after that, I went to a year of general surgery internship at Harbor-UCLA, which was amazing. And then I started a PM&R residency, but I ended up leaving for health reasons and found myself kind of in a little bit of limbo. I was going to do a general practice, and I started that. I started a general practice, and I was in San Diego at the time. And I found this physician who was a plastic surgeon who was transitioning his practice already to doing anti-aging medicine. He kind of introduced me to A4M, and the rest is history. I mean, it was like meant to be. The first conference I went to was in, I want to say March of 2013. It was definitely 2013 though. And it just made so much sense scientifically, medically, from a humanistic standpoint. It just, I found myself kind of, like I said, flailing a little bit. I went into med school to do orthopedic surgery. After my third year, I decided I didn't want to do surgery. God bless all the surgeons out there. But, it takes a certain personality type to have that lifestyle. And it wasn't for me. And then, transitioning in PM&R, I thought I found a happy medium, but nothing invigorated me during med school or after more than learning the foundational kind of principles of anti-aging regenerative medicine. So it absolutely, allowed me to lay down this foundation upon which I've built my practice and my craft on. And, it created definitely its own learning curve and issues, trying to figure out how to run a practice on your own right out of the gates, trying to also do that while, not providing the traditional services that, most insurance companies will typically reimburse for. So trying to figure out how to create a balance there that was viable. And, going back to some of my core drive for getting into practicing medicine, providing equal care, regardless of socioeconomic background, that creates a little bit of a challenge as well, because if we can't take insurance for most of these things, then you have to charge cash prices, and not everybody can, afford some of the full suite of services. So that created a challenge. Also, 6 days out of the month, I work with another physician group, a couple orthos, an internist, some chiropractors, and it's really a low income clinic. We treat the workers of the city, and to be able to provide this anti-aging, preventative, regenerative medicine by way of education, by way of equipping them with tools where they can apply and adapt these things to their lives, and monitoring them and talking about things like what you should and shouldn't be eating. Why is sleep important? What supplements should I use after telling you my symptoms? What is hormone replacement? Why do I need to exercise? How can I get more motivated? All of these things, being able to share that with this other population of patients has been incredibly rewarding. And I just hope to build that and continue to build that.
You make a special effort to provide medical services to a low-income population. Why is this important to you personally?
It's very important to me personally. It's really my driving force in wanting to become a physician and getting into medicine was really spurred by disparities in healthcare I saw growing up. My mom was a huge influence. She's a registered nurse. She was bringing me to meetings where she was the director for the Monterey County AIDS Project, the flagship AIDS Project kind of support group in that area in the late 80s, early 90s, in the beginning of that pandemic. So I really developed a passion and a drive to provide equal care to everybody. And then, getting into the Drew program at UCLA, again, I applied to that program because of the mission, which is really to provide service to the underserved. And we have huge healthcare disparities in the country, and we've seen that with the COVID pandemic. We see Black and brown populations and low income and obese people and elderly people dying and getting sick much more than people who are better off and not Black or brown. So these are, when we have a stress to a system, it highlights these things, and it brings the cracks in the boat, start to take on water. And that's kind of our healthcare system right now. And so every experience I have with these patients, it's when I have a really touching experience, it just reinforces that. And so many of these people will come in from 1 month to the next and have lost 4 family members to COVID. I had an elderly Spanish-speaking patient who was a month out from losing her husband to COVID. And just these devastating stories of people who just fall through the cracks, but they run our country. They're the workers. They're the people who work in the factories. They clean our whatever business you have. They work in the kitchens. They work in the fields. And I think as a country, we owe a huge debt of them, not just a debt of gratitude, but a debt of service. Let's find a way to provide equal care to these fellow citizens of ours. So my passion, kind of in a nutshell, started as a kid, and with my mom being a nurse and showing me these disparities firsthand, and then experiencing them coming up, volunteer work, and then the hands-on experience in practice, and seeing the difference that can be made when someone comes in. And I had 2 patients now in the last 6 months who have lost. One person lost 35 pounds, one person lost 60 pounds, and their pain is gone. They don't have, pain from back pain, low knee pain there, but that's not it. It's like their whole life is going to change if they can maintain this. And so, God, if we can do that on any scale, that's just amazing.
Thank you. Dr. Ford, are there any particular treatments your practice offers that you've noticed are unique to even other anti-aging practitioners?
This is a great question. I think it highlights, I just keep saying how wonderful the field is, but I think this highlights another great aspect of the field. And I would answer that, most practitioners in the anti-aging regenerative space customize and kind of develop, micro tweak our procedures and our treatment protocols, based on the literature first, and then we kind of customize our treatments down. So I say all my, your experience here is going to be unique, whether we're doing hormone replacement, whether we're treating your torn meniscus in your knee with PRP or exosomes. Your experience here is going to be unique based on how I provide care, based on how my staff, provides care and walks you through the process. And I think that is absolutely wonderful. It brings back the feeling of, the town doctor. The other thing that we're doing here that is, I think, really unique is, this is a big side thing, but I'll keep it concise. For the last couple of years, I've been working on a research protocol in the realm of CBD and really trying to do a really sound, randomized, placebo-controlled double-blind study where we're really evaluating CBD as a viable alternative to the current pain medication profile that we have, opioids being the big killer and the big problem. But then physicians don't really have anything to fall back on as far as prescribing something effective. We have NSAIDs, Tylenol, and then off labels like nerve pain medications. They have a limited utility, and I would argue, a much higher side effect profile. And so we're left with this kind of paucity of effective care for people in either chronic or acute pain. I know at some of the conferences, we've had some great lectures on the effectiveness of CBD, full spectrum, medical marijuana on pain. And I think it's really time to do a proper study. And we're looking for an FDA approval for a pain medication that's a CBD-based medication, and hopefully presented as a viable alternative to opioids right now. And I think either way, as a scientist, as a physician, I am completely fine with the study going completely to its end, and we find out there's no significant difference versus placebo or versus, standard of care, if you will. But I think the question needs to be addressed in this formal way, and we need an answer, and we need guidance on this, and I think that'll help guide prescribing. So we're working on that here as a big project, and still kind of maintaining our practice as well.
Dr. Ford, conventional medicine is developing guidelines for treating all disorders. Practitioners are not only encouraged, but often feel pressured to practice within those guidelines. Do you feel this is helping or harming the advancement of medicine?
This push to stay in your lane, stay in your specialty, your subspecialty, is harming the advancement of medicine. I think it's corporatizing medicine even further to where physicians are really, fearful of some kind of recourse or some kind of penalty, whether being kicked out of their physician group or insurance MPNs and this kind of stuff by practicing outside of their absolute specialized scope. And it's taken away our ability to be physicians and scientists at our base. If someone comes in for, the removal of a cyst or something to their dermatologist, the dermatologist should be able to talk to them about, basic stuff about blood pressure, cardiovascular health. What are you eating, by the way, while I'm doing this procedure? How much sleep are you getting? These are things that physicians should feel comfortable integrating. And I think, unfortunately, we have a system that's really a sick care system. And we are really good at saving lives. I mean, I wouldn't want to be anywhere else in the world if I was in a life-threatening, injury situation. We're the best at that. We're not good at preventing disease. We're not good at optimizing the human experience. We're not good at optimizing longevity and really preventing disease. We're good at treating disease. We're good at managing disease. And I think this further impairs our ability to, transform our healthcare system into just that, from a sick care system to a healthcare system. We're really prolonging quality life and preventing disease.
I want to thank you so much, Dr. Ford, for spending your time with us this afternoon.
My pleasure. My pleasure. Thank you again so much for having me. And I hope, we'll be in Vegas in December.
Yes, that is our hope.
Yeah.
And I would like to thank all of our listeners for tuning in. Until next time.